Hello everyone. Today we are at Oman Cancer Association in conversation with Professor Taha Lawati, who is the head of Breast and Surgical Oncology Unit at Royal Oman Hospital. He will be educating us about the most common type of cancer, that is breast cancer in Oman. Professor Taha, welcome to the show.
Thank you very much.
So could you please tell us if you have been seeing an increase in number of cancer patients in Oman lately?
Well, you see, in Oman, since we have started the cancer services or the health services all, there is an improvement of quality of services. And that also led to an increase of early diagnosis. And the people started trusting us more. So we are looking into more of early diagnosis and more of cases diagnosed. That doesn't mean the increase of cancers, but increase of number of cases get diagnosed in early stages. Plus the population since 70s till now has doubled from 2 million to 4 million plus. And that led also to increase of number of cases, but that's not abnormal because the number of population has increased. Aging is another factor also, which is normal. With the aging, we get more of cardiovascular diseases and cancer diseases. Anyhow, if you look into the international statistics, we are within the normal statistics. So there is no increase in number, but there is more of detection of cancers now, and we are treating them better now.
So it's just the number increasing with people becoming more aware?
Yeah, and we're having more of early detection and early diagnosis of cancers actually.
Right. So Professor Taha, if I'm not wrong, I believe breast cancer is the most common type of cancer that people in Oman have been facing. So is it true that out of all 10 breast cancer cases, like female breast cancer cases, there is always one of a male breast cancer?
Yes, indeed. Breast cancer can affect men. It affects not 10%, around 5%. The percentage is lower. In some countries, even 3%, but affects men. In Oman, in the last published statistics, we had around 190 breast cancer and pre-malignant cancer, that's in situ tumors. Out of that, we had around 10 male breast cancer. So out of 190, we had 176 confirmed breast cancer for women and around 14 pre-cancer cases, which is early detection. And we had around 10 male breast cancer. The point is this, as I said earlier, we are getting more of early detection. Pre-cancer stages are treated only with surgery without a lot of expenses of chemotherapy, targeted therapy, which has a lot of burden on the health system. Male cancers are detected in these cases. Unfortunately, male cancers, because of the structure, the anatomic structure of the male, they come in late stages because there is no fat to capture that tumor. So the tumor infiltrates easily the skin and the muscle. So it is usually a bit late stage, it doesn't come in early stages like in the woman.
Right. So Professor Taha, how do you detect if a man, or both, say men and women, have breast cancer?
Well, detection of breast cancer in women, we have clear pathways, and these pathways are published. There is the screening mammogram. One of it is the mobile unit, which we have in Oka, which goes around. And by the way, in October, we're having a campaign which will go around in all the Sultanate. It will go by the mobile unit, accompanied by doctors and social workers, educators, which will go in each wilayat of the Sultanate. Will stay a few days. Doctors will be going around to give lectures. Health of educators, etc., will be around, talking to the people and telling them about breast cancer awareness. They'll be talking even to the doctors at all levels, GP, specialists, and surgeons about what to do when there is a detection of breast cancer. So it will be a big campaign in coordination with Ministry of Health, and that campaign will go for 1 year, complete 1 year. It will start from October to October next year. The other one is done in privacy by woman herself can do it, is the breast self-examination, Pamphlets are distributed by OCA freely, and Ministry of Health having also pamphlets which are distributed at the health center level. There is the third way is when we talk about male breast cancer. Male breast cancer, the only thing the male will notice a lump which is abnormal or a nipple discharge, mainly bloody nipple discharge. Then he has to come to the doctor, and the doctor will do the needful for him by testing it in a way which we call a triple assessment. Triple assessment, that means that he will assess the lump first of all clinically by examination, taking history. Number two, by taking a biopsy from that lump and taking a radiological or an X-ray for the special X-rays for the lump to see what type of lump. So these three methods done together, gives us a confidence of diagnosis which is from 97 to 99% of what's going on inside the body.
So 99% you get proper
Diagnosis.
result and diagnosis.
Yeah, but one thing I would say, we should not, or the patient should not act like a doctor. If there is anything to go to the doctor.
Yeah.
It is very important because doctors are trained to treat these cases. It is the doctor who has to make the diagnosis. I always say to my patient should not be worried because getting worried, they get to themselves high blood pressure, hypertension, and they get to themselves diabetes, other things. Doctors are paid to get worried. It is our duty to get worried for the patients. So we are paid for that. Let us do our duty.
So basically you take all the stress of the patient.
Yeah, that's our duty actually. We are paid for that. As you are paid to make an interview with me now today. So please let us do our duty.
Professor Taha, it's a very good thing that you brought up. Do you think the stress would actually trigger the situation or would actually cause more effect?
You see, being faithful, relaxing is something which is very important in having any type of treatment because it gives you a situation where you get a better immunity, and cancer is weakness of immunity. So it gives you a better immunity in the body, and that will help you in fighting the cancer. So it's very important that the patient has tranquility, has calm in her life, needs support of the family. Whatever stage, a support of the family and feeling comfortable with the treating team is very, very important to pass through the period of treatment. Otherwise, she will have disturbance at the psychological level, and that will affect even her treatment.
Right, Professor Taha, so going back to the breast cancer in men, do you think it has been increasing over the years or people are getting more aware of it?
No, it is not increasing. It goes with the percentage of cases we are getting. I don't see there is an increase really in the numbers. From 3 we are reaching to 5, so but from the other side we can see that the numbers when I started, when I came first from France and established the first specialized breast cancer clinic, that was in 2003 in Royal Hospital. We had around 70 breast cancer cases.
Both men and women?
70, we didn't have a lot of men cases. We had only 2 cases that year. Today we are having around 200 breast cancers, or crossing 200 breast cancers, but we are having 10 male breast cancers. So it is proportional, the increase. It is not different than what's going on. So I think there is no drastic increase in the male breast cancer, but there is a proportional increase, and that's normal.
Right. So in both cases, since you have said it has gone from 70 to 200, are those cases of early detection or are those one?
Well, in the woman it is early detection. In my opinion, women are much more intelligent. But, and that's even for the anatomical structure, because the woman has a breast and there is fat which can embed the tumor and protect the body. Men doesn't have that. And once they get the tumor, it is easy that infiltrate the skin or the muscle. And when it gets detected, it's already in an advanced stage. And that's the difference. But treatments are there. We get treatment for this type of cancer by what we call neoadjuvant. That means we start with chemotherapy ahead of surgery, that to shrink the tumor in a way and make the surgery much more easier by getting a better safety margins when we resect the tumor. Plus, with our methodology of surgery, in women we need always to do what we call oncoplastic. That means we have to reconstruct. By the way, in Royal Hospital, 70% of the women get out of their surgeries with preserving the breast, either by doing a breast conserving surgeries or by immediate reconstruction. Men, they don't need that, so that part is not important for the men as much as for the woman. So here the philosophy of surgery is quite different, and it is easier for the surgeon to go and remove all the breast for a man, while for a woman, before removing a breast, we think 100 times really doing that. And thank God now with the new standards of surgery we're having, with oncoplastic introduced, we are having 70% of women who doesn't need to have a removal of the breast, or if they have to, they have immediate reconstruction with implants or with analog tissues from other places of the body. So most of the
that's
women,
definitely a psychological change. I mean,
it is. It makes a lot of difference for the woman.
Absolutely. So about the treatment, Professor Taha, is the treatment more or less the same in both women and men when it comes to breast cancer?
Well, when we talk about chemotherapy, radiotherapy, it is almost the same. But when we talk about surgery, I explained to you, in the woman, we have always to think about reconstruction and immediate reconstruction. For the men, we don't think about that because most of the men, they want just to get rid of the disease. Another thing, it's the chemotherapy. For the men, chemotherapy, and for the woman, chemotherapy is almost the same.
Okay.
It is the radiotherapy. Most of the men will need radiotherapy because there is not a lot of space to protect the muscle. So most of the time, the tumor is very close to the muscle or involving the muscle. So they need radiotherapy. Well, the woman is not always there, and there is enough safety margin, so radiotherapy is not always indicated. So radiotherapy gets evaluated case by case. Diffusion to the lymph nodes, also another indication to get radiotherapy, and that differs in the men. A lot of them get diffusion to the lymph nodes.
Right.
So that's also will be looked into case by case.
So I want to know, how painful is the treatment? I mean, I'm sure the disease itself is painful. I mean, having a breast cancer or any type of cancer, but how painful is the treatment of breast cancer?
See, there is one thing. Cancer is a disease which makes people afraid of facing it. So there is a lot of work which we have to do before we start treatment. It's the moment that we know there is cancer, we should think how to talk to the patient. And we need to have the support of the family. Once we have that, then we can start. We cannot jump and talk about treatment before preparing the patient. I can tell you, once I had a patient who went through the surgery, and after the surgery I told her, after looking to the final results, we need to go for chemotherapy. She said, no way, I'm not going to lose my hair. She was very precise about it. I'm not going to lose my hair. Whatever you do, I'd rather die than losing my hair.
Oh my God, it was that serious.
Yeah, she was, that's it. I said, okay. I don't want to argue with her because she was in a situation that she was very nervous, tears in her eyes. I brought her a glass of water. I said, okay, just relax. I'll see you next week. Then I asked her husband to stay back. And I told him, she needs your support. It is you who can help her. I cannot help her. You are there with her 24 hours. You know, she has 2 sons and 2 daughters. What did they do? When I saw, I had tears in my eyes. Next week, they came, all shaved bald, girls and boys. She told me one thing, let me be like them. She didn't tell me start me chemotherapy.
Oh my God. So family support is definitely
This is a
one of
message to the families.
That's amazing.
Support your dears.
Yes.
You see, these are touching moments in our life.
Absolutely.
These moments which let us think how much we love our dears,
Right.
our mothers, our sisters. And that's why I say we should not always depend on a doctor to give us medicine.
Yeah.
We should live it.
Mm.
And there I said, okay, we'll start treatment. And she passed it. And she still comes and say hello to me whenever she passes by the hospital.
So she's feeling all good now?
I'm really proud of her.
Oh God.
I'm proud of her husband, and now they're grown up.
Mm-hmm.
I'm really proud of her.
Yeah, so yeah, I'm sure like in this kind of condition there is nothing better than a family support and love from your loved ones.
Yes.
Definitely. So yeah, on that note, I also wanted to ask you about the cost affiliated with the treatment of cancer.
Yeah, as I said, when it is early stage, maybe surgery is enough, and the surgery cost won't cross whatever we do 1,000 riyals. If you go to private sector, maybe 2,000 riyals.
Oh wow.
But if you go to chemotherapy, targeted therapy, let me tell you, chemotherapy cost will be around 10,000 riyals full course.
Mm-hmm.
While if we go to targeted therapy, patient will need around 23 to 25 injections, and each injection by itself it is 1,000 riyals, regardless of the hospitalization, cost of nursing, etc. So the cost crosses easily 30,000, 40,000 riyals. That if it is late stage or advanced stage. So we are talking about cost which crosses 50,000 riyals if it is late. Now the resources are there. If we get it in the early stage, those resources could be used to improve services and get better services like transplants, like other things. So that's my message again. Please come whenever there is a mobile unit or whenever for screening and get early detection. It's not only the cost, because the cost is the last thing which comes to our mind as health care providers. It is the side effect you are going to save from your life. You'll not have to go through the side effect of chemotherapy, of radiotherapy. You'll just have small surgery and come out. Well, if you have, God forbid, advanced stage, then it is big surgery with big scarring, with a lot of pain. Reconstructive surgery is having its own side effects also. Then going through chemotherapy, radiotherapy, targeted therapy, hooked to the hospital, you have to come and go for at least 1 year to the hospital, not having a normal life. So all that things are affecting negatively your normal quality of life. Where should we go through it if we can detect it early? One of the things, people feel shy coming to the hospital.
Yeah, I know. I have come across a lot of people who are actually afraid to go and get it checked.
Yeah. We should not be afraid to get checked. We should be afraid of the disease.
Yeah.
So we should come to the hospital, get checked to fight that disease. We should know that doctors and society are on the same side to fight against the disease. This is a bad disease. When it is early, we should not fight against it with big weapons. But then when it is advanced, we have to use big weapons, and big weapons has big side effects.
Right.
And those side effects are really bad, unfortunately. We have to be really, really strong in facing it. And we sometimes feel sad of giving those drugs which has bad side effects. We explain to the patient, etc., but we don't feel comfortable with it because we feel that we're giving a drug with a strong side effect.
Right, but Oman Cancer Association has been doing a tremendous job in providing free clinical checkup every month, especially for women over 40 years old. It's like walk-in checkup.
Yeah.
And I know that you also spoke about this camping that is launching next month in Salalah, that you guys will be going to all the regions and all parts of Oman,
Yes.
and will be spreading and raising awareness about breast cancer in both men and women.
Yes. Actually, Oman Cancer Association, since it has been founded, it is doing this service. One of the leading projects we had is the mobile unit, which has been going around and giving a lot of cases for screening and detected a lot of cancers, early cancers. It has contributed in detection of early breast cancer. This year we had a better programmed campaign with Ministry of Health, where it will go to the main hospitals and main health centers and call for the patients to come and do screening. So it is something more organized this year. I hope it can be repeated every year. We are having it, as you say, each wilayat and each muhafadat will be there for at least 2 weeks or 3
Okay.
weeks, depending on how big it is. We try to screen all the women above 40. Once we do all that, we'll come out with the statistics, and then we compare it with the statistics of the years before. And if we have a better statistics, better outcome, then we'll ask Mr. Khalid to help us to do it yearly.
Right, so wishing you all the very best with the campaign, Professor Taha. It's definitely an amazing initiative that you, in help with Ministry of Health and Oman Cancer Association, jointly are carrying out this campaign for the betterment of the people of Oman. So wishing you all the best, sir, for that.
Thank you very much. And we also depend on your support by diffusing the information to the people, because we cannot live without you telling to the people what's happening so they can come and join us, because we are hand in hand, we are working together.
Absolutely.
We cannot work without you telling people what's going on. You are our voice to the people.
Absolutely, sir. We're always there together in this cause. So thank you so much again for joining us on the show. It was definitely an informative session with you. Learned a lot, got to know a lot about breast cancer and the detection and how to examine. Thank you so much, sir.
Thank you
so
very much.
Thanks. For more interesting videos, keep watching Times TV.